Good afternoon, everyone. Myself, Dr. DEEPAK Kumar, final year internal medicine resident from Pravara Institute of Medical Sciences, Loni, Maharashtra, India. The topic of my research paper is correlation between D-dimer and CT severity score in middle-aged young adults with COVID-19 pneumonia, a retrospective study. Introduction. An unknown pneumonia broke out in Wuhan city in December 2019, and it was confirmed as an acute respiratory infectious disease and which was affected by a severe acute respiratory syndrome coronavirus 2, formerly known as 2019 novel coronavirus. The disease was subsequently named coronavirus disease 2019, that is COVID-19 by WHO on February 11, 2020. Which was a highly contagious and can cause serious lung injuries resulting in death. Generally, the majority of the COVID-19 positive patients are presenting to the hospital with symptoms of respiratory infections with case fatality rate of 1.4 to 4%. The gold standard technique for the diagnosis was reverse transcriptase polymerase chain reaction with high specificity, that is RT-PCR. Still, the investigation's downside is the lack of sensitivity and lengthy time to reach diagnosis. The CT scan is a readily available fast technique with high sensitivity, despite having a very high sensitivity, which can be up to 97.2%. Unfortunately, CT had a very low specificity, which can reach up to as little as 25%. Disseminated intravascular coagulation is one of the major underlying causes of death in these patients. Consumption coagulopathy, which should be obviated in order to decrease mortality, arises in DIC with decrease in fibrinogen and increase in the D-dimer levels. In fact, fibrinogen and one of its end product, D-dimer, have also been reported to have a predictive value regarding the mortality of patients with non-COVID sepsis secondary to complications of disseminated intravascular coagulopathy. Therefore, anticoagulation, considering its mortality benefits in non-COVID sepsis, may also have an important role in the treatment of COVID-19. The influence of coagulation dysfunction on the prognosis of COVID-19 is attracting increasing attention. However, studies on predictive and prognostic value of coagulation parameters in the settings of patients with COVID-19 is still limited. The purpose of this retrospective study was to investigate the correlation between these two, that is the D-dimer and CT severity score of the patients of COVID-19. The aim and objective was to correlate between the D-dimer and CT severity score of middle-aged young adults with COVID-19 pneumonia. Materials and methodology, it was a retrospective study. The present retrospective study was conducted in the Department of Medicine in Rural Medical College, Loni, Maharashtra. The data taken from the entries of the COVID register. The study comprised of 108 subjects reported COVID RT-PCR positive during the study period, that is January to August 2021. Out of 40 young adults of age group 30 to 40 were taken, and with no known ongoing medications or comorbidities were selected. That is, I wanted to make sure that no other medications or no other disease condition in the patient is influencing the effect between or the correlation between D-dimer and CT severity score. Inclusion criteria, the same, 30 to 40-year-old young adults with no known comorbidities. Whereas exclusion, the patients with chronic liver disease, patients ongoing who are having ongoing anticoagulant drugs with previous history of pulmonary embolism, DVT, and patients with sepsis and myocardial infarction, and patients with comorbidities such as hypertension, diabetes, thyroid disorders, cerebrovascular accident, COPD, PCOS, ischemic heart disease were excluded. And COVID-19 was diagnosed on the basis of WHO, World Health Organization interim guidance, and Indian Institute of Medical Sciences protocol. Severity of COVID-19 was defined according to WHO clinical management and guidance. Severe type was defined as following with fever or suspected respiratory infection plus any one of these, that is respiratory rate more than 30, severe respiratory distress, saturation less than 90% in the around air. A questionnaire was prepared as per, and the documents were collected and the information was collected. Patient's date of admission and discharge were recorded. COVID-19 infection was confirmed by RT-PCR. Pneumonia was confirmed with CT, that is computerized tomography, within 12 hours of admission, and patients with specific cardiovascular diseases or anticoagulant use were removed from the study. Coagulation test, which that is fibrinogen D-dimers, were performed using Sysmac CS5100 automatic coagulation analyzer Japan and prioritized reagents. Available pharmacotherapy options right now for these, according to WHO and AIMS criteria, are antivirals, anti-inflammatory supplements, and anticoagulation. Imaging requisition was CT was performed to all the patients using 16-channel CT scan, and the CT was done, that is ranging including the whole chest from the thoracic inlet to the diaphragm. All the patients who were scanned without contrast media injections, and the patients in supine position with breath holding at the end of the inspiration, the CT was taken. And the parameters of the CT scan were the tube voltage 120 kilovolts, tube current for 50 milliampere, rotation time 0.5 seconds, and slice thickness 5 millimeters. CT analysis, two experienced radiologists evaluated the CT and independently, and the discrepancies were resolved with agreement. CT images of each patient were assessed by the presence of distribution of parenchymal abnormalities, including ground glass opacities, consolidation, multifocality distribution, that is the ground glass opacities or peripheral or diffuse with septal thickening, crazy pavement pattern, pulmonary nodules, pleural effusion, mediastinal lymph nodes with short axis of more than 1 centimeter. These are the various photos of CT pictures of the patients which I included, which are showing ground glass opacity, septal thickening, reticular pattern, and pulmonary nodules. These are a pattern of expected CT, that is computed tomography, changes in the patients with COVID-19 pneumonia. Whereas in ultra early stage, the patient will have CT scan which demonstrate bilateral, subpleural, multiple scattered ground glass opacities. With early stage, that is 1 to 3 days of symptoms like fever and dry cough, patients will have bilateral ground glass opacities with irregular intralobal septal thickening. And the patients in rapid progressive phase will have consolidations, dispersed air bronchograms with superimposed irregular septas. And in consolidation stage, there is a decrease in the size of the lungs with the density of consolidation. In dissipation stage, the patient will have interlobar septal thickening along with consolidation and reticular opacities. CT severity score was assigned to each lobe of the lung and were added the total of 5 lobes, that is no involvement less than 5%, 25 to 50%, 50 to 75%, and more than 5%, 0, 1, 2, 3, 4, 5. And the mild grade was up to 7, and moderate grade was up to 16 score, and the severe grade was up to 25 score. Statistical analysis was done using means and standard deviation of the groups using SPSS 22 for Windows, and difference between the two groups were determined with student t-test, and level of significance was set up to p less than 0.05. Logistic regressions were used to associate factors with severity of COVID-19. Results were, of my study, the present study comprised of 40 subjects, of which 11 were female, 29 were male, and the mean age group was 38.52 plus or minus 5.34. The mild, moderate, severe CT scan reports of these patients are like this. Out of these 40 patients, 16 had a mild score in their CT scan, 21 had their moderate score, and 3 had severe score. That is 40% of the patients had mild, 52.5% patients had moderate score, and 7.5% had severe score. And mean D-dimer of these patients were calculated, which was 0.54 plus or minus 0.09 in mild CT severity score, and the same mean D-dimer in moderate was 0.91 plus or minus 0.02, and the severity of severe CT severity score D-dimer was correlating to be 1.96 plus or minus 0.04. Hence, D-dimer was showing to be having increasing along with the CT severity score. When mean D-dimer level was compared statistically between mild, moderate, and severe CT severity score, it was found to be statistically significant. This was the table mentioning the same. Mild patients with mean D-dimer score and with standard deviation, moderate with mean D-dimer score, severe with mean D-dimer score. As the severity of the CT severity score increases, the D-dimer value goes on increasing. According to multivariate analysis, D-dimer was significantly associated with a CT severity score. Discussion: the cohort study aimed to investigate the correlation between the CT severity score and the D-dimer. The present study comprised 40 subjects, of which mean age was 38.52 plus or minus 5.34. In the study, D-dimer was found to be correlating with the CT severity score. As the CT severity score increases, the D-dimer also was increasing. The similar results were reported in Han Yun et al. And Hong Chin et al. Gone and colleagues analyzed 1,099 patients with laboratory confirmed to COVID-19 from over 550 hospitals of China, found that non-survivors had significantly higher D-dimer than the saviors. And similarly, Niti et al. Also observed the abnormal coagulation results, especially marked elevated D-dimers in the death of COVID-19 patients. And Fuso et al. Conducted a retrospective study of 191 patients of COVID-19 and found D-dimer was greater than 1 microgram per ml on admission, was associated with high in-hospital death. And similarly, other studies also supported the same. D-dimer levels on admission were higher in patients needing critical care support than those who did not need ICU treatment. Therefore, the recent guidance on recognition and management of coagulopathy of COVID-19 from International Society of Thrombosis and Hemostasis arbitrarily defined markedly raised D-dimers on admission as 3 to 4 folds increase. And similarly, other studies also, the Ibrahim AI Mohammed et al. And their study revealed the same. According to Lan Yun et al. Revealed the same. Natural logarithm of D-dimer level was significantly associated with CT. Were these the findings of other similar studies? Limitation of my study was, despite of all the efforts to include all qualified patients, some patients still excluded from the enrollment due to absence of D-dimer level at the admission. Second, due to the difference of patient size and medical resources, the length from the illness of onset to the admission or to the institution of the included patient may not be a representative, which might influence the D-dimer and fibrinogen level of the body. Conclusion: based on all findings in which D-dimer levels time was matched to the time of CT scan, we have reasons to correlate that D-dimer level may predict the severity of inflammation prior to coagulopathy or thrombosis. Uncontrolled inflammation response itself could result in severe lung injury and sequentially aggravate coagulopathy, thrombosis, and can lead to poor outcomes and even death in COVID-19 patients. This could be an additional explanation of mechanisms of elevated D-dimers level predicting high mortality. Further researchers are needed to investigate and relationship between dynamics of D-dimer level and severity of inflammation in coagulopathy. These are my reference, and thank you.
Thank you very much, Deepak Kumar, for your very interesting and good presentation. Audience, do we have any question for this presentation, please? Thank you, sir. I assume we don't have a question for you.
Thank you.
Thank you.